Welcome to my Pdsa Project. I am Jennifer Livingston. I am the Stroke Care Coordinator for Winter Haven Hospital, and I wanted to show, does support for newer nurses make a difference? The objective was to shadow newly licensed registered nurses, providing support to improve prioritization, skill level, confidence, patient care, and retention. The questions that were asked was, does support with newly licensed registered nurses improve their ability to prioritize? Does support with newly licensed registered nurses advance their skill level? Does support with newly licensed registered nurses increase their confidence levels? Does support with newly licensed registered nurses improve their patient care? And does support with newly licensed registered nurses increase retention rates? The predictions made were, support provided to newly licensed registered nurses will improve their ability to prioritize. Support provided to newly licensed registered nurses will advance their skill level. Support provided to newly licensed registered nurses will increase their confidence levels. And support provided to newly licensed registered nurses will improve their patient care. Support provided to newly licensed registered nurses will increase retention rates. The who, what, when, and where. Who, newly licensed registered nurses with 1 year of experience. What, how does support impact their overall practice? When, night shift, because that's when less leader support is present. And where, medical surgical unit. The plan. Well, an initial observation of the newly licensed registered nurse, current prioritization, skill level, confidence level, patient care, and their thoughts on remaining a nurse, transferring as a nurse, or changing careers. Also, a baseline description from viewpoint of the newly licensed registered nurse regarding their perception of their prioritization, skill level, confidence level, patient care, and retention thoughts. Also, periodic evaluation surveys of the newly licensed registered nurses' changes in prioritization, skill level, confidence level, patient care, and retention thoughts based on the support they received. In the end, an assessment survey of outcomes achieved through support. The nursing theorist that I relate to this project is Jean Watson and her theory of human caring. I believe that caring is the basic element of nursing, not just for the patient, but also for the nurse as an individual and a professional. Nurses give, naturally, a tremendous amount of themselves to their patients and their patients' families, and that can cause a strain on the nurse's own well-being. Support through caring is a way to give newly licensed registered nurses the tools they need to be successful, balanced, well-rounded, find meaning in their career, and persevere. The do. I initially met with the 2 nurses that I supported during the project. I wanted their permission and to let them know the information obtained would not be reported to their manager. That was a concern. I also observed their current level of prioritization, skill, confidence, patient care, and I asked about their thoughts on actual nursing. I asked the nurses to complete a survey, and I created to understand their perception of their prioritization, skill, confidence, patient care, and retention thoughts. This is the survey that I created. Most of the answers are 1 to 5, with 1 being disappointing and 5 being exceptional. The question regarding how many questions are asked per shift was a general range, number range, and also there were retention questions like, do you enjoy being an RN? Is being an RN what you expected? Have you considered transferring? And have you considered changing careers? The results. Interestingly, in general, Nurse M is perceived among her peers to be less capable than Nurse A. In reality, Nurse M showed more confidence in herself in the initial survey. I spent approximately 4 hours each week with each nurse. The sessions consisted of one-on-one discussions regarding medications, patient care, what it is really like being a registered nurse, prioritization, career paths, coping and balancing family and career, and any general topics that came up. I shared a lot of personal experience and attempted to be a resource, a listener, and an advisor. The second survey, after 3 weeks, another survey was administered with similar results. The second survey showed improvement in the results for Nurse M in regards to her opinion of night shift support and teamwork improving, and a decreased number of questions needed to be asked per shift, which indicated an overall improvement. The second survey showed improvement for the results for Nurse A in regards to she felt she had an increased medication knowledge, and also that she began to ask less questions per shift, which indicated overall improvement. The results then of the second survey clearly indicated that the sessions up to this point have been successful in improving skill level through medication knowledge and confidence level by decreasing the number of questions needing to be asked per shift for both nurses, impacting their nursing practice and patient care overall. The second survey did not indicate an improvement in prioritization and retention thoughts, but be aware the retention rate was already at the highest level in the initial survey. So neither nurse had thought about changing careers, not being a nurse, transferring, or any of those things at that point. So the third survey, so after another 3 weeks of sessions, same amount of sessions, about 4 hours per nurse per week, the third survey was administered to gauge the overall improvement in both nurses' prioritization, both nurses' skill level, confidence level, patient care, and retention rates from the initial to the third survey. The improvements shown in the third survey for Nurse M included feeling more confident in prioritizing her daily task, increased confidence level overall, and a further decrease in the number of questions. The improvement shown in the third survey for Nurse A was an increase in confidence with prioritizing daily tasks, and all of her other answers remain the same. The third survey results clearly indicated an increased confidence in prioritization of daily tasks, and as a natural result of that led to improved patient care and both nurses' confidence level overall. Throughout the sessions, the retention questions have remained the same for both nurses. The confidence levels have improved for both nurses, the prioritization of daily tasks has improved for both nurses, and medication knowledge increased for both nurses. The skill levels increased as a natural result indicated by improvement, but was not indicated in the actual survey answers. So the study. Does support with newly licensed registered nurses improve their ability to prioritize? Yes, that was clearly indicated by the survey results. Does support with newly licensed registered nurses advance their skill level? Yes, but it was not clearly indicated by the survey results because their answers on that question remain the same. Does support for newly licensed registered nurses increase their confidence levels? Yes, clearly indicated by the survey results. Does support for newly licensed registered nurses improve their patient care? Yes, as a result, but not clearly indicated by the survey results as they felt they gave the same patient care. Does support for newly licensed registered nurses increase retention rates? In theory, but not clearly indicated by the survey results because the retention rates from the beginning were at the highest level. So the psycho questions. So the dimensions of quality in healthcare are care that is safe, effective, timely, patient-centered, efficient, and equitable. In addition, care should have value, be accessible, and preventative. Efficient, safe care improves the value of care, translating into actual healthcare dollars. So the cycle questions we answered were, what are we trying to accomplish? Well, our objective is to shadow newly licensed registered nurses, providing support to improve prioritization, skill level, confidence, patient care, and retention. And how will we know a change is an improvement? We are sure of this through obtaining a standardized, simple survey at regular intervals from the nurses involved in the sessions. What change can we make that will result in an improvement? Well, we have shown that the change of having a support person available, even if periodic, does help improve the elements of our objective. The surveys ensured the information was realistic, clear, concise, measurable, and meaningful. So that is the conclusion of the PowerPoint for the Pdsa cycle. Overall, the student learning objectives were achieved. I was able to use technology. I was able to show leadership. I was able to advance professionally. I was able to not only advance professionally by myself, but to help fellow nurses in their overall feeling of self-worth and ability improve. The BSN program, I feel, throughout this process helps to promote continuous growth for nurses and is essential in improving our practice overall.